Thanks to the COVID-19 lockdown, lots of industries are now exploring digital, virtual, online models in order to deliver the services they offer to their customers. This is true whether it's Amazon, online groceries, food shopping, cosmetics, education, for example. Everything is moving online. I wish IVF could move online so that instead of your having to come to the clinic, we could come to your, I won't say bedroom, but to your home and provide the IVF care for you in your own house. I don't think that's going to happen. Long way off. And at least until we reach that point, the question is, what can we do digitally, virtually, online for IVF patients to help reduce their expense, their costs, and more importantly, help them to get the right medical care? Now, always remember, there are two things. One is the process and the second is the outcome. Outcomes are always uncertain, but the process is something you can control. And we can help you make sure that not only do you follow the right process, you can actually make sure that your IVF doctor also follows the right process by being armed with the right information, what we call information therapy. And this is why we're so generous with it and actually have been much before this COVID-19. We've been doing this for 30 years. We provide information therapy online about IVF, everything you could possibly want to know, the risk, the complication, the treatment protocols, what good doctors do, what bad doctors do, what you need to know, what you can do to maximize your chances of getting pregnant, what happens in the IVF lab. We effectively try to demystify the process so that you know at least as much as to what goes on in an IVF lab as your IVF doctor. That's not to say that you're going to prescribe your own medicines, you're going to do your own ultrasound scans or your egg pickup, but at least you'll know what questions to ask your doctor or the sonographer or the embryologist to make sure that he's not bullshitting you and that he's providing you with high quality answers, the right answers, to make sure that the process is being followed properly. Not everything in an IVF cycle is in your control, but there are two things in your control. One is arming yourself with information, and that's what digital is so great for. And that's one thing we do extremely well on our website. We've got pages and pages of information. We've got lots of videos, and even better, we can provide a customized free second opinion, which I provide personally for all patients. Just email me and you'll get a reply. And I need as much information as you can share about your medical details so I can provide an intelligent, customized reply. Doesn't mean you need to come to me for your treatment, but you do need to make sure that your doctor at least follows the process which I've outlined. I'm not saying we have all the answers or that our process is the only one, but it'll help you to make sure that at least your doctor is following the correct process so he can justify why he's choosing not to follow the process I'm recommending. Openness, transparency is ultimately in your best interest, and every good doctor takes pride in educating patients and sharing information. Unfortunately, many doctors don't do this well in real life. They're way too busy. They've got too many patients. They'd rather be doing procedures. They don't like being asked questions. They get irritated when you ask questions. They say, what, you went to Dr. Google and you think you've become an IVF specialist? They actually put you down in your place. They use a lot of technical jargon. They dissuade you. They discourage you. And they're not even willing to see you. They make you wait for hours on end, or you're forced to see a nurse or an assistant who doesn't have the answers. You don't even see the same doctor twice often because the doctor keeps on shifting duty and it's like an assembly line. And if you're fed up of all this, then please come to our website. That's free. What do you lose? Just make sure that, you get the right answers, or at least you learn how to ask the right questions, if nothing else. And if the doctor doesn't answer your questions, that's a red flag. So don't waste your money if you find that the doctor is unwilling to share information with you. So that way you can make sure that you're following the right process, that you're in control, that you've chosen the right doctor, if nothing else at all. Happy to see you online on our website, happy to answer questions digitally, and more than happy to actually treat you. And whether the treatment is digital by information therapy to help you to make the right decision for yourself, or whether it's real life where we actually make the embryos and put them back, I'll be equally happy in either case because I am an IVF doctor and I do want to help you to have a baby. Look forward to seeing you soon.